as well that medicine sometimes it's a really uncertain field. So if a patient's outcome is not as expected, or it didn't turn out as you imagined, like how do you cope with the negatives?
Yes, even the moment you choose surgery, so this is always you should get ready for this. Always any surgeon or any doctor tries to do their best. So want to have a best outcome, but whatever a surgeon tries, the negatives are always there.
You can't always control the situation.
Yes. So especially in neurosurgery, this margin of error is very, very less. When you are operating, for example, in brain surgeries, you are operating in aneurysm, the margin of error is very less there, and you have very
less
time to react. The moment the aneurysm ruptures when you are operating, you don't have time to react. So you should be quick enough to catch it or control the situation. Otherwise, you lose the patient on table. So there are so many situations where you have done best of the best surgery, but suddenly patient post-operatively goes bad. In brain and spine, we see sometimes you have done a very good surgery, very clean surgery.
But suddenly
patient is not moving, patient is not getting up, patient is not moving the limbs. This happens many times. So as a beginner, you have a lot of pressure, because if this happens in your first case or second case, you will become devastated, because you can't practice. You have all the fear that what if the next case happens like this. So this happens in many lives of a surgeon, especially neurosurgeon. Your luck should be there. That's very important, and your efforts should be there. And how you counsel the families when you are operating any patient, how well you have counseled the families and explained about the risks of surgery, the complications of surgery, and how much efforts you have put to take care not to harm the patient. When it happens, then personally, though you can't show the emotions on your face, but still inside you will have a lot of emotional trauma, and there you should have some good companion or a friend to discuss things. If you have a very good team, or like what I do is always I discuss with go home, tell mummy that this happened in the morning. She says nothing happens, so she will become, the patient will recover, don't worry. So that gives us solace that okay, at least some person is there talking
someone
positively.
Is like by your side.
And when you have a good friends around, where especially our colleagues, when they say don't worry sir, this is going to be okay, then you get your what you say that the
solidarity.
Yes, so you become your mood becomes elevated, and you cope up with that. But as you become experienced surgeon, you know you can assess which surgery will give you trouble. So you are more careful. You talk to the relatives that this can happen, or sometimes you can avoid surgeries. So these things become better and better, and emotionally you become more stronger. So this is always there in a surgeon's life. That's where I see so many surgeons sometimes break down emotionally, and they quit surgery, they stop surgery, they change their profession, they start some business, or they become so depressed. And there are so many people which I know, they start taking antidepressants, they start drinking, smoking. So because the stress of a surgery is too high. So, but yes,
so you need really good mental fortitude.
Yes. So you need to tune yourself. That's where your training of your residency time comes into effect, where you have a very proper training to your residency. So the pressure you can take the pressure more when you are practicing a real in your life. But if a residency is not that strong or not properly trained, then you will fumble and do a lot of mistakes and you are
Lot of
dangerous to
crash
the
and burn
patient.
will happen.
Yes, so always that's why we say the training part should be very focused, and we need to train them hard.
Fundamentals need to be
Need to
solid.
be very strong. Otherwise, when you become a surgeon, you just imagine you are operating and there is a bleeding and you don't know how to control. How will you tackle the situation? So that is where your training comes, and always you need to have help or you need to work as a team, so that something happens, one more hand should be there to help you. So that's why any big surgeries always plan, anticipate and have a team. So that's why you want to have a best outcomes, don't be alone, have a good team and work as a team, then you will have a very good outcome. So this stress part or this negative outcomes, that negativity comes out of this bad outcome, you should be really strong to come out of it.
And
You need
cope
to
up
have a
with
good
it.
family, good friends and good team.
A
Only
good
then you
support
can,
system.
support system should be there, otherwise you will suddenly drown in the fears and you cannot operate well. So yes, to have be a good surgeon, you should be emotionally very strong.